Hello, today I will be talking about Crohn's disease. I chose this disease not only because it's familiar with a lot of people, but also because I have a couple family members that have been diagnosed with this disease within the last 5 to 10 years. Crohn's disease is said to be IBD, which is an inflammatory bowel disease. Don't mistake that with IBS. IBS that affects the muscle contractions of the bowel, which is more like when you're trying to use the bathroom or trying to keep yourself from using the bathroom. Those muscles will actually hold the intestines or whatever, keeps you from using the bathroom in spurts like that, or trying to use the bathroom or having to use the bathroom on yourself. That's randomly out of the blue. Crohn's disease. What is Crohn's disease? Crohn's disease is basically a chronic or long-lasting disease that causes inflammation and irritation in your digestive tract. There are no causes of Crohn's disease. There is an unknown factor, but it is believed to be an autoimmune disease, which was later discovered that is inflammation. The inflammation of the Crohn's wasn't coming from immune system attacking the body, but resulted in concluding that the immune system was attacking harmless viruses, bacteria, or food in the gut. Crohn's disease is a genetic disease. It's genetically inherited, and it's believed that 20% of the people that are diagnosed with Crohn's disease typically have a relative that has Crohn's as well, or they have or they have ulcerative colitis. This is pictures of Crohn's disease. On the left, you can see, like I said, it infects the lower intestines mostly, and it's an intestinal disease. So on the left, we have a picture of intestines. Now, these round things, that's inflammation in the intestines. Just imagine eating, trying to digest food, that is going to hurt. Or regardless, if you're not eating and you have an episode of your Crohn's flare up, you will have pain in your lower abdomen section, because that's where your intestines are, due to the inflammation. Is going to hurt all the time. And on the right are rashes of Crohn's disease. I actually didn't know that Crohn's disease come with rashes, but they are prevalent. You won't see the rashes all the time on anyone with Crohn's disease. Crohn's diagnosis. You can do blood tests, balloon assisted enteroscopy, capsule endoscopy, colonoscopy, computed tomography, which is like a CAT scan, CT scan, magnetic resonance imaging, it's MRI, which we've all heard of that before, and an upper endoscopy. Now, I found that the capsule endoscopy is very interesting. It's basically where you swallow a tiny pill-sized camera to give the doctor a closer look at your small intestines. So I never heard of that, but that's pretty cool. You can like swallow a small camera. Upper endoscopy, which checks esophagus, stomach, and first part of small intestines. Like I said earlier, Crohn's disease is a GI tract disease, which is a mouth to anus disease, which makes sense for upper endoscopy to be first to try to see if you have any symptoms of Crohn's disease. Because like I said, it's from mouth to anus, which checks your esophagus, stomach, and first part of small intestines. The signs of Crohn's disease can be anything from chronic diarrhea, weight loss, fever, abdominal pain, like I said earlier, and tenderness, feelings of mass or fullness in the abdomen, and rectal bleeding. There are two types of complications that come with Crohn's disease. One is called local, and the other one is systemic. Local is it only happens in the intestines. Now with systemic, it affects the whole body, also called extraintestinal complications. The early signs of Crohn's disease would be in children with Crohn's are likely to be shorter and weigh less than those without. They may stop getting taller before the symptoms start. So that's where growth failure comes into play. And then, of course, delayed puberty. Everyone should know what that is. Of course, your child just hits puberty later. What makes Crohn's disease worse? Infections, like the common cold, cigarette smoking, certain anti-inflammatory drugs, as far as aspirin and ibuprofen. With Crohn's disease, you have periods of symptoms that can last 4 days, weeks, or months, followed by periods of remission. Remission is when you have no symptoms, but remission can last days, weeks, or years. Treatments of Crohn's disease is anti-inflammatory drugs, corticosteroids, immune system modifiers, antibiotics, drugs for diarrhea, and biological medicines. Controlling Crohn's. What roles do food play in Crohn's disease? While foods don't appear to cause Crohn's disease, soft, bland foods can cause less discomfort than spicy or high-fiber foods when the disease is active. Most doctors try to be flexible in planning their diets for their clients that have been diagnosed with Crohn's disease. You may also try to eliminate your diet, which can help you figure out which foods trigger your Crohn's disease. You'll remove things from your diet one at a time just to see what happens. Work with your doctor or dietitian to make sure you don't miss out on any nutrients while doing it. And also, with doing that, that'll allow you to make sure your proper diet will stay in balance and that it is safe for you.